Hello and welcome. I'm Betty Karleski, and this is the healthcare series, Are You Prepared?, presented by the Bethel Park Chamber of Commerce, Freedom Home Care, and Betty Karleski Consulting. The purpose of this series is to educate the community about various aspects of healthcare and the options that relate to each specific topic. Today's segment is segment 3, After the Crisis, Medicare Certified Medical Care. Medicare certified medical care can include home health services like intermittent skilled nursing care, physical therapy, speech and language pathology services, continued occupational services, and much more. Usually, a home health care agency coordinates those services with the doctors. Another form of Medicare certified Medicare coverage is hospice. Hospice care involves a team-oriented approach to expert medical care, pain management, and emotionally and spiritual support expressly tailored to the patient's needs and wishes. At the center of hospice and palliative care is the belief that each of us has the right to die pain-free and with dignity, and that our families will receive the necessary support that they need to allow us to do so. Based on this information, today's segment will feature 2 different areas of medical care, hospice and home health care. Our first guest today is Joy Paglia. Joy is a healthcare representative from VITAS, which is a national hospice company caring for patients for 30 years. Joy Lynn has been working in healthcare for 10 years. She grew up in Southern California and has traveled extensively, but eventually settled right here in Pittsburgh, where she raised her family, and has been a resident of Bethel Park for 27 years. Welcome, Joy Lynn.
Thanks, Betty.
Well, now that we know a little more about Joy Lynn and VITAS, let's learn a little more about hospice.
Well, that's my passion. Hospice is my total passion, and I think there's not enough information out there. So I'm glad to be here today to, just give the information to the folks out there. So I guess the biggest question is, what is hospice and how does it work? So hospice is a full-service package for comfort care, basically. When you've decided that you do not want any more aggressive therapy, we aggressively treat the symptom, not the disease. So you're still getting pain management and anything to treat that symptom. And it's not just for the family, for the patient, it's for the whole dynamic. Mm-hmm. So having hospice come in, and hospice can be wherever you are. It's not a place where you go necessarily. There's places you can go, but it's made really for home, to be home with your family in your bed and die peacefully where you want it to be. Mm-hmm. Hospice includes all your medications. It's part of a hospice benefit.
What about equipment? If you need any equipment in your home.
Yeah, bedside commode,
oxygen
in bed, anything that you would keep you comfortable at home. Mm-hmm. Mm-hmm. So you don't have to go, like I said, to a hospital, because nobody really, if we surveyed 90 people, most of those people would say, I want to pass in my own home with my family, right, in my pink fluffy bed, mm-hmm, with my dog and my cat, mm-hmm, next to me. So right, I think that's important, and everybody should know that they have a choice to make that decision. A lot of times physicians tend to give you those options, but they don't give you all the options to let you know that hospice is something that you can choose. Right. And you can choose any hospice, because there's many of them out there that are great you can choose from.
So when you reached a point where you've decided you're tired, you don't really want to do any more aggressive treatments.
Exactly. Like I said, it's a full-service package for it has bereavement for after the fact.
Now tell us a little bit about bereavement.
Bereavement, we have most hospice has a bereavement counselor. Within that, they work through the whole process with the family before the passing. Mm-hmm. So they know what it looks like, what to look for, what it's going to feel, what they're going to feel, more or less. So it kind of helps that patient and that family member work through with quality of life and dignity. which is very
So
important.
kind of last wishes and
So they can talk it over. They can say, I love you. They can say, whatever they needed to say beforehand. Right. And after the fact, the family has bereavement counseling for at least 15 months in most cases.
So even after the patient has passed away, the family member's passed away,
absolutely,
the family receives services from the hospice company to help them through their grief.
Yes.
That's wonderful, Joylene. That is. Now, who pays for hospice?
Well, that's the best part. It's a free benefit. It's paid by Medicare. So anybody who has Medicare gets it's a free hospice benefit for those folks. For the other folks that are under, which unfortunately there are folks under 65 that don't have Medicare. Most insurances do cover this. And like I said, it's 100% covered. There's no co-pays.
Well, that's wonderful because it takes the burden off the patient and family, again, to not have to worry about payment.
Absolutely.
Describe for us who the team is that comes in for hospice services so everyone understands that it's a team effort.
Yes, we call it the interdisciplinary team, and within that you have a medical director, which is the team physician. And one of the myths that hospice has is that you can't have your own doctor when you choose hospice. That is a myth. You can have your physician follow and attend as they had before, but we have a physician as well that overlooks things. So if your physician that you've had for 25 years is on vacation or you can't get a hold of him, our physician can take over and decide what medication to give you at that time or what to do for that moment. So you can keep your same physician. So we have one as well. There's a nurse, a chaplain, social worker, and I guess bereavement counselor as well. And the social worker is wonderful too because they come to your home. So if you're transitioning, say, from the hospital to home, a lot of times nobody really knows what the home situation's like. So the social worker comes in, it kind of assesses the situation, and if that family has some family dynamics, which we all know that happens, or that family member maybe has doesn't go grocery shopping, so they need Meals on Wheels, they can take care of all that.
Okay.
So that's
help you find the services that you need.
Yes, so that's a big benefit to the family as well as the patient. Social worker, chaplain will come in. So we look at it as it's not religious; it's spiritual. So it's for all. It's non-denominational. So a lot of times that brings people to peace when they have someone to talk to, brings them back to their faith, whatever their faith was, and it's brings the family peace as well at end of life.
Now, one of the things you mentioned was the person's physician, but also the hospice medical director. Who decides if you're appropriate for hospice care?
Two physicians, our team physician or the team physician and the physician. There has to be two to say, yes, you are appropriate for hospice. To be appropriate meet the criteria for hospice, the doctor has to pretty much look at you, Betty, and say, hey, Betty, you have a terminal illness, and if this illness progresses in the way that we think it will, you probably won't be with us in 6 months.
Okay.
So that's what the physicians have to look at. Now, they're not, nobody knows for sure, of course, but that's part of the criteria for the physicians to look at.
Right. So they're not really giving up on anyone. Basically what they're doing is offering comfort care services, what they call in healthcare palliative care, so that you're comfortable, but the person with the illness gets to make the decision about how they want to spend their last days.
Exactly. And we make all these decisions for planning for weddings and births and everything else, but we really don't think too much about planning for our passing.
Right, it's true. And it makes it so much more comfortable for everyone when you make these plans in advance and everyone knows what the next step's going to be.
Exactly.
So any last thoughts?
I think it's really important to research. If you're thinking about going on to hospice, looking into hospice, I think it's important to really look at everybody's computer, on the computer these days, or in the library, and really look into the hospice, what it does. If this is something you feel that you've reached a point where I don't want any, I want to hit my bucket list. I don't want to be attached to tubes and feeding tubes and everything. I want to go off and visit my grandchildren in Florida. You know, I think those are the important things.
Right. So it sounds to me like the operative word here is choice.
Exactly.
You get to make the choice of how you want your last days to pass.
You haven't, in most cases, we don't have those choices because we're not physicians. We don't know what, you know, what our what we can do for ourselves. But this is at a point where you can make that decision and say, you know, I want to be at home, or I want, you know.
And hospice can be in your home, actually in your residence.
Absolutely.
And it can be if you're in a personal care home.
It can get anywhere your home is. So
and you can, even if you live in a skilled nursing facility.
Absolutely. So if you're in a retirement community,
okay,
we can come in there.
Okay. Wherever you are, wherever you call home.
And if you're not comfortable being at home, or if you're not comfortable being in those places and you want to go to an inpatient unit, there are inpatient units out there that you can stay in as well. They make it very, very comfortable for the families.
Wonderful. Well, we've certainly learned a lot today about hospice care and how incredibly helpful it can be to both the patient and the family. Thank you, Joyce, for being here with us today. We thank you so much for all this valuable information. And we will be right back after this commercial break. Welcome back to our healthcare series, Are You Prepared? If you're just turning into our show, we're exploring Medicare certified home health care. Now, let's take an in-depth look at how home health care works and who it serves. Our second guest today is Marcia Matthews, owner and administrator of Freedom Home Care. It's located right here on Stoltz Road in Bethel Park. Marcia, I know that you personally see patients every day, so thank you so much for taking the time to come and talk with us today about Medicare certified home health care. Marcia's a registered nurse since 2004, spent the last 10 years dedicating herself and the last 7.5 years to Medicare certified home health care agency Freedom Home Care, helping people remain in their homes as long as possible. Her goal is to do what is right for the patient at every turn. You will not find a more dedicated or compassionate healthcare provider in this area. Now that we know a little bit about Marcia, let's learn about Medicare certified home health care services. Thank you, Marcia.
Thank you, Betty.
All right.
That was quite the introduction.
Wow, you're a force to be reckoned with here in the South Hills.
Well, thank you. Medicare certified home health care is it's an organization, or it's an all-encompassing healthcare system that is a continuation of hospital discharge or doctor's office. It's physician referred. It is actually medical services that are provided in a patient's home or their place, of residence, which could be assisted living. It typically includes skilled nursing, physical therapy, occupational therapy, speech therapy, home health aid. And it can also include medical equipment or supplies if needed. Some of the home care that people receive are, long-term and complex. People are generally discharged from the hospitals a lot quicker. Their acuity at home is increasing, as we have seen over the years. But generally, a rule of thumb, people do heal faster at home. And with everything insurance driven today and all the, the healthcare volatility, it is, imperative for the hospitals to do timely discharges, and more people are going home with home health care. It is also, home health care also acts as a coordination of care, because as the population ages, which we're seeing, greatly seeing, and people are living longer, they have a lot more specialty physicians in addition to their PCP. So what home health care does is they coordinate all of the care between all the physicians and the specialties, which makes it a lot easier for the family and the patient to make sure that they're getting all of the required care that they need at home, including medications, safety, ambulation, all of the things to do to keep them home and be safe at home.
So you basically have an RN who's overseeing your entire healthcare needs, checking your medications, making sure you're getting the therapy that you need, making sure you don't have duplicate medications because you may have 4 different doctors.
That's correct. And that it is also in conjunction with the primary care doctor or referring physician, that if there is a change in the care plan, which is initiated from the very beginning, a very in-depth, detailed care plan that goes on the start of care with the family, with the patient. A registered nurse always does the start of care, and it is reviewed with a physician, constantly and continually and changed as needed. And it also keeps people on the right track, keeps their doctor's appointments, and makes sure that they're taking the right medication.
Good. That's good.
Which in turn, the goal is to keep them out of the hospital.
Which is a good thing.
Yes.
Nobody wants to be in the hospital.
No, and there are a lot of laws with readmission.
One of the things that just came to mind while you were talking was we kind of get the feeling that you need to have been in a hospital to then be on home health. But if you're at home and you're experiencing decline,
right,
then you can also get Medicare certified home health services.
That is true. A lot of people or a lot of patients historically, when they go to the physician is able to identify those patients that are having difficulties at home. Whether it be medications, when their medications are reviewed, the patient is unsure of really what they're supposed to be taking. That would be a triggering event.
So you can educate them about
Yes.
the medications. Okay.
Yes, we can educate them, we can teach them, we can set up pill boxes, medication management, make sure that they're not duplicating, and to make sure they understand what they're taking.
And why they're taking it.
And why they're taking it.
Right.
And in situations where they shouldn't take it or need to call the physician. So those are also, or if somebody is having difficulty walking or showering, and safety is a big issue, and a physician picks up that safety is becoming an issue, they'll also order.
What if a daughter or a son goes to visit mom or dad and says, "Wow, she's having trouble on the stairs," or she seems to be having trouble getting in and out of this chair," that type of thing?
Well, in that instance, that family member can call the physician, and they will order home care. They'll contact the agency of the patient's choice and ask for an evaluation, as long as the patient has been seen in the doctor's office within 90 days, or seen by a physician in the hospital, wherever, by a physician within 90 days, or plan on being seen within 30 days, they qualify for home health care.
Okay.
They have to have a face-to-face requirement that has to be met.
Okay, okay, that's good to know. That's good to know. You mentioned the word choice. I think that's an important thing to talk about. How does choice play into certified Medicare certified home health care?
Well, that is with all the competition and the competitive market for home health care providers, sometimes choice seems to get to the wayside. But as a rule and as a requirement that Medicare requires, that people do have the choice to choose their health care provider, their dentist, their doctor, their lawyer. They can also choose their home care provider. And Medicare defines it as a freedom that a patient has a choice. And if they are qualified to perform the services that a physician has ordered, they definitely have the right to choose who their provider is going to be.
So even if the doctor or the hospital says, "Oh, well, we're going to refer you to XYZ home health care," the patient can still say, "I'd really like to use Freedom Home Care."
That's absolutely correct. The patient does have a choice to say that, and a lot of times people don't know who, and so they look for their provider or to the social worker in a hospital or doctor's office to make a recommendation. So my suggestion really is that people should educate themselves before a crisis occurs, when they need to have the service. Right at that minute, you have to make a choice. You're waiting for discharge, you have a list of providers to choose from or agencies to choose from, and you're overwhelmed and you don't know. So people should definitely have be educated and informed of the different companies, and it's personal choice. You are choosing somebody to come into your home and take care of you.
Right.
And you should have that prepared ahead of time, or be a little bit educated about it.
Let me ask you this question. What if somebody gets a referral because the social worker referred it, and the team is coming to the home and they're not happy?
At that point, the family, the patient needs to call their physician, voice their concern, and ask, if there's somebody else they can recommend. Generally, though, if they're not happy, they should call the company and voice their concern or grievance of why they're not happy. Okay. If they don't get anywhere with that, there's also information on a Start of Care that there's an 800 number to call Medicare. Okay. It's their complaints and voice it. But, in general, people don't like to cause waves or a disturbance.
But as a business owner, you want to know if the patients...
I want to know.
You want to know if the patients
I want to know, right. And the patients have the right to choose a different company as well.
Okay.
Without any explanation. They don't need to give a reason. They can call their doctor and say, I'm not happy. Let's move on.
Okay. And the last big question is, who's paying for this?
Well, Medicare, Medicaid, and most insurance companies have some sort of home care benefit attached to their policy. They pay for it. Home health care is designed to be acute short term. It is for teaching, education, wound care. If somebody is coming out of the hospital or develop a diabetic wound that needs even daily care, the insurance will pay for it if the patient is unable to do it themselves. There is a homebound requirement. The patient it's a taxing effort to leave the home, or they have to take public transportation and it's not safe for them to leave the home by themselves. That is a homebound requirement in order for all of it to be paid for. Okay. And your insurance will pay for it based on necessity.
So Medicare will pay for this.
Yes.
Marcia, this has been incredibly informative. Thank you so much. You've been so instrumental in helping us understand this particular part of our Medicare certified the payment process and the services that are provided. We thank you. We want to extend our thanks to you and your team, and thank you so much for all the help you've given to the seniors here in the South Hills.
I love what I do, Betty.
And we can tell that. Thank you so much, Martha.
Thank you.
Our next segment is segment 4, After the Crisis, Non-Medical Care. Be sure to turn in and learn more about assisted living facilities, non-medical in-home care, and independent living facilities. As always, we hope that you found our healthcare series, Are You Prepared?, has been providing you with the valuable information you need to make your current and future healthcare needs. Now for our health tip of the day. If you've noticed that you've become unsteady or are falling more frequently, you might require the services of a home health agency. Some other criteria for a physician to order home health care can be uncontrolled pain, wounds, or cellulitis, and generalized weakness, just to name a few. Contact Freedom Home Care at 412-835-1200 to learn more about how we can help you stay in your home and get the care that you need. Or you can visit the website www.freedomhomecaresforyou.com to see a complete list of the criteria and to learn more about our staff and the services that they provide. Our health is the most important thing we possess. Help us help you nurture it and take care of it.